Okay, so the next skill that I'm going to show you guys is hand and nail care. So pay attention to the way that I'm saying that, hand and nail care, because first you're going to take care of the patient's hand, and then you're going to take care of the nail care part of it. So if you remember that the way that it's said, it's going to help you a little bit, okay? We're only going to need 21 for this, so it's going to be 2 washcloths, 1 towel, okay? So here we go. We're going to introduce to our patient. Knock, knock, knock. Good morning, Mrs. Jones. How are we doing today? Good. Excellent, excellent. My name is Michael, and I'm going to be your CNA today. And I'm going to go ahead and perform hand and nail care on you. Is that okay? Okay, fantastic. Now for the test, you're only going to do one hand, so just remember that, okay? So we're going to go ahead and close the curtain for patient's privacy, and I'm going to go ahead and wash my hands, okay? First things first, you always want to make sure that there is a clean surface for you to do your patient's hands and nails on. Okay, there we go. Then I have to get my linen, okay? So I'm going to get 2 washcloths and 1 towel. That's where I'm getting the number 21 from. I don't want to confuse anybody. Okay. Next, I'm going to get my soap and my lotion. Okay. And it's okay if you have to run back and forth. That's okay. They don't want you in the test grabbing 100 things and dropping stuff on the way to the table and you know, causing that type of problem for yourself. So the next thing I'm going to grab is going to be a nail file, okay, or an emery board, and an orange stick. Okay. Now the orange stick has 2 ends on it. It has a toothpick, very sharp end, and then it has a beveled edge. Okay, you're only using the beveled edge. Don't use the toothpick end. Okay. So I'm going to go ahead and get my water. Okay. Now for this, you want to go ahead and get lukewarm water, about halfway full. I have to test it, and then my patient has to test it. So will you test that for me? Does that feel okay? Yes. Fantastic. All right. So now I'm just going to have a seat, and this is where you can have meaningful conversation with your patient. Ask them how their day went. Okay. So first things first, I'm going to grab my patient's hand, and I'm going to put it into the basin, and you have to say out loud to the evaluator, I'm soaking for 5 minutes. So you're soaking the hand for 5 minutes. They're not going to wait that long, and then you're going to be able to take your patient's hand out, okay? Place it right on the chuck. All right, and if you've watched many of my videos before, you'll see that I normally like to put these right in the basin so that way they get wet, okay? So first things first, I got to go ahead and wash my patient's hand. Okay, so go ahead and take this, put some soap on it. All right, and I'm just going to take your hand here. All right, washing from the wrist to the fingertips. All right, make sure you get in between the bottoms and the top. Okay, now you are going to put this in your hamper. Okay, so for right now, I'm just going to say that this is my hamper here, but if the hamper is far away from you, get up and put it into the hamper. Okay. So now it's soaked. I'm going to go ahead and rinse. So I'm rinsing her hand, okay, of all the soap. There we go. That gets placed in the hamper. And now I'm going to dry my patient's hand. Now what I like to do is I just like to open up the towel and just kind of rest the hand in. You're patting dry. Okay. Fantastic. So now the hand care is done. So now I need to do nail care. Okay, so I'm going to take the beveled edge of my orange stick, and I'm going to go under each nail, okay, and after I go under each nail, I'm wiping it off on the chuck. Put the dirt on the chuck, because you're going to throw the chuck away. All right, there we go. Again, this is a good time to have meaningful conversation, asking your patient how was their day. Okay, so there we go. So that looks good. Now we're going to file the nails, okay? Special way to file the nails for this is just to kind of square them off. So you're just going to go side, side, and front, okay? Side, side, and front. So you're just going to go ahead and do that with each nail, okay? Side, side and front, side, side, and front, side, side, and front, and side, side, and front. Okay, we'll discard this later. Now what you want to do, and you have to say out loud, is you have to check for any rough or jagged edges. So you want to say that out loud. I'm checking for any rough or jagged edges. I do not feel any. So the last thing, which is always the best thing, is the lotion, okay? Pea-sized amount in your hands. You're gonna warm it up, and then you're gonna go ahead and rub your patient's hand. Make sure that you give them a nice little hand massage, okay? And now you're gonna pat the excess lotion off. Okay, there we go. How's that feel? Good? Very excellent. So now we're just gonna take that off, put the patient's hand back in their lap, and now we're going to clean up. Okay, so I'm gonna go ahead and discard my emery board and my orange stick. I'm gonna take my soap and my lotion, put the supplies away. Okay, I'm gonna now take my water, and again, I'm just gonna go ahead and rinse this out 3 times. It only requires you to rinse it out twice for the test. I just like 3, it's just a number that I can remember easier. I'm gonna go ahead and get some paper towels, dry this out. You don't wanna put anything away wet. And now I'm going to pull the chuck away from my patient, okay? That way if there's any nail shavings or anything of that such, it gets put in the chuck and gets thrown away. Okay, these were already in my hamper. So Mrs. Jones, is there anything else that I can do for you today? You're all done? Okay, fantastic. Can I get you a magazine or anything?
No, thank you.
Excellent. Here is your call light. If you need anything, please give me a ring. I'm going to go ahead and open the curtain so my patient can see a nice little view. I'm going to perform hand hygiene. You check your skill, make sure you've done everything correct, and then look to the evaluator and say, this skill is done.